This pink-loving, tutu-wearing princess had a healthy start to life.
Never had an ear infection, never had a cold.
But the last year and a half has been anything but a fairy tale for 3-year-old Grace Braun.
Her face began to swell like she was having an allergic reaction. Or maybe had a sinus infection and her face was puffing up.
They rushed her to the hospital in their hometown of Clovis, New Mexico. Test after test. Found nothing. Then a doctor's words changed everything.
She said, "I think you need to sit down." And I said, "Okay."
Nothing could prepare Jessica for what came next.
She said, "Well, I'm telling you, it could still be a funky virus." She said, "but it's also a sign of leukemia."
All in one breath, the doctors laid out the options.
And I'm just standing there, and I had no idea what to do next. I just kind of looked at Grace.
Overwhelmed with information, they prepared for the long stay at the Children's Hospital at UMC.
Within 24 hours of being here at Lubbock, they had put in her port, they had given her first dose of chemo, they had extracted bone marrow and confirmed that it was the leukemia.
Already devastated, the news would get worse. Grace was diagnosed with T-cell leukemia, a rare form with a very low survival rate.
And now we were dealing with T-cell, which is completely different. It's horrible. Not many kids make it through T-cell.
But not making it wasn't an option for little Grace. Doctors instantly began a rigorous and exhausting treatment plan. In just 8 days after her diagnosis, Grace was in remission.
Grace was a fantastic responder. I think even Dr. Al-Khalil, who's done this for 30 years, had never seen anybody respond like her.
But her battle was far from over. The very thing meant to save her life quickly became her nemesis.
While cancer is horrible and can take someone's life, every time you give a dose of chemotherapy, you are feeding a body toxins.
The Brauns were prepared for her hair loss and weakness, but they weren't ready for what happened last summer. Grace had a terrible reaction to a type of chemo called Aracy.
Her liver it shut down. It would not metabolize it at all. She gained 6 pounds of water weight in like 36 hours. She wouldn't move. She wouldn't talk. She wouldn't laugh. She wouldn't look at you.
Grace's heart began to fail.
You're told what's going to happen and how things could go. But when you hit those bumps in the road, that's when reality hits you.
Doctors were just hours away from putting her tiny body on a ventilator.
That was the first time that we didn't know if we were going to get to take her home.
Grace underwent a life-saving procedure to remove fluid from her lungs, and after a year of hospital rooms and more pain than most people feel in a lifetime, Grace has finally reached the home stretch.
She's probably had 30 blood transfusions, just as many platelet transfusions.
Although Grace has 13 months of chemotherapy left, there's a bright future ahead.
This is what has saved her life, this hospital, these people. What do you say about the people that have saved your child's life?